The Health Committee meeting to order. Under previous business, can we get a motion to approve the previous meeting minutes?
Motion.
Wanda, second by Sean, all in favor?
Aye.
Any opposed? Number one, local law number S for 2018, local law to require hospitals to post their policies on reproductive health care, non-discrimination charity care, and admissions in Albany County. Mr. Kale. Are you going to table this?
Yes.
Okay. Any questions for Mr. Kale in the meantime?
Not a motion to table. Motion to table, just move
I didn't know,
on.
I just, yeah.
Yeah, there's no discussion after motion to table.
Resolution number 494 for 2018, public hearing, and proposed local number S for 2018, that's the public hearing. It's gonna be tabled. Local law number E for 2019, a local law of the County of Albany, New York, restricting the sale of flavored tobacco products. Mr. Miller here. He was going to address some questions, but he's not here, so we'll table this one as well. Okay, under current business, number 4, authorizing agreements with the New York State Department of Health regarding tuberculosis prevention and control program. Hey, Dr. Willa, how are you?
Good evening, very well, thanks.
First off, I want to congratulate you and Ms. Witherspoon and your whole department on your accreditation. You guys have gone through the exhaustive process. What was it, 2 years?
Yeah, a little bit more than that.
Yeah, so congratulations.
Thank you
It's a
so
real
much.
testimony to your whole department, so.
Thank you, and I would just like to say that we'd like to thank the legislature for recognizing our accreditation. It was a very nice gesture, and for ongoing support as well, and particularly to you, Chairman Joyce, who assisted in meetings for accreditation when we had the site visit. We really couldn't have done this without your support, so I appreciate it.
Thank you, but I think, less than 10% of all county health agencies have this accreditation, so it's real.
Yeah, we're number 6 in the state, 7 including the state DOH.
So, thanks to you and your staff, so. Number 4, any questions for Commissioner O'Malley?
Can I ask a question? I noticed this is the reporting of TB cases. How many are reported annually, or whatever you'd say?
So it varies year to year. I believe for last year it was 12 cases, but we can see between 7 and 12 cases a year. But this grant not only covers active TB, for which we send nurses out to do directly or observe therapy, but we do a lot of testing for latent TB. So people that may come from countries that are endemic, we have a clinic, people that have positive PPD conversions, they need therapy to prevent them from getting TB, and those numbers are much higher. We saw about 450 people in our clinic last year and placed about 591 PPDs. So the scope of work is bigger than just active TB.
Thank you.
Commissioner, that's $39,000 a year, not for 5 years, correct?
That's right, $39,000 a year. And this is something that we're mandated to do under Article 6 of the Public Health Law. There are counties that don't get funding. We get some additional funding. This is the additional funding that we get because we have higher numbers than other counties.
Any other questions for Commissioner O'Malley? Any other questions for Commissioner Whalen? Get a motion moved?
Motion.
By Wanda, second? Second. Al, in favor? Aye. Any opposed? Number 5, authorizing an agreement with Health Research Incorporated regarding the Public Health Emergency Preparedness Program.
And this again is our emergency preparedness program for the amount of $296,000. This is continued funding that we have been getting for a number of years. This year we actually had a decrease in funding of about 4%. This funding is used with state homeland security to prepare for emergencies and response, which would include both bioterrorism emergencies and emergencies related to communicable disease. We work with MRC volunteers, and we have over 500 Medical Reserve Corps volunteers that are ready to respond, and we drill with them on a regular basis to prepare for the public health emergencies that can be faced.
Any questions for Dr. Whalen? Then we get a motion to approve. Sean, second. Wanda, all in favor?
Oh, yes, sorry.
Opposed? Thank you. Number 6, authorizing the submission of a grant application with the Governor's Traffic Safety Committee regarding the General Highway Safety Grant Program.
Okay, so this is, we have received funding for 2019 General Highway Safety Grant Program, which is addressing pedestrian safety. We've done a lot of work in Albany County. The work plan is included in the documents that are provided to you today. What this additional year and additional monies is designed to do is to improve the footprint, to expand the area that we are working with, particularly the Central Avenue corridor, which we know is associated with a high rate of car accidents and unfortunately pedestrian-related accidents. So it will enable us to do a lot of public education, to reach out to hotels and other businesses along that route and provide education to the public, among other things.
Gary?
We have a very serious speeding problem in our neighborhood on Buckingham Drive in the city of Albany. Who determines how these funds are allocated so that we can get more law enforcement to enforce the speeding laws in them?
So this particular, I'm not sure what the answer to that is. This particular grant comes from the Department of Motor Vehicles.
Yeah,
I think that, where this grant could help, where activities like this could help a problem like that, is to look at how you do road calming. And they've done that along Manning Boulevard. They had 2 lanes on either side, and they created a pass
so
lane in the middle.
so they're doing, we've already done a study
Yeah.
on New Scotland and Buckingham, paid with, St. Peter's actually paid for it. In Albany Med, we have a major problem with traffic when the hospitals are letting out and coming in. And it's very, very bad. So how can this, I'm just trying to see how we can access some of this money through what agency, if it's the Albany Police Department or the Sheriff's Department.
I believe they have separate funding for those.
They're both separate?
Yeah.
So what does the funding do then?
What is this funding doing? As I said, and as you can see in the work plan, we have provided a lot of education, and we have worked with the city and municipalities. There's a number of partners that we have listed here, mainly from the public health perspective, since it's not a great amount of money. What this is used for is to provide public education. So we have people that go out and talk to school kids about pedestrian safety. We go to public libraries. And in this iteration of the grant, as I said, there's a lot of hotels along that particular corridor that we know has high risk for accidents.
So is this just for Central Ave?
No, it's not just for Central Ave. It's going to focus on the Central Avenue area, going out into Colonnade.
But it's going to concentrate on
Yeah.
Central Ave. How'd they pick Central Ave? Just because of the,
I think they look for the high-risk areas, and I think that's one of the highest risk areas for pedestrian motor vehicle.
well, we get a high-risk area that's going to happen someday soon in Albany, on Washington Avenue, where they got those 3 storms built. The Block 75, they'll build, and you go, these kids are just walking out in the middle of that street, in the middle of the night, dark, wearing black clothes.
Okay. Yeah,
Some
you're
kid's
right.
gonna get killed up there because they just cross the street, they don't go to the lights, they don't, I don't even know how they ever got the variance to build those things. But someone's gonna get killed. Someone should be going up there with this money and talking to SUNY and those students up there, because that's gonna be a real problem in the future, because they wanna build 2 more.
There's
Two
no,
more,
they need some kind
Yeah.
of overhead, something that,
They were supposed to put an overhead in. That was in the original plan, then that went away. And now, and they reduced the speed limit to 30. The officers that I know that patrol that, the average person that gets pulled over is doing 60. So, and it used to be 40, used to be 45. So that's good, that's gonna happen.
You have people going right off I-90.
Yeah, they're coming off I-90
By the
and they're
Herder one,
still,
right?
you know how they do it. They keep speeding, you know.
Yeah.
They did that on Van Rensselaer.
So there's some way you can use some of that funding to educate
Amazing.
these SUNY kids. I think it's your district, Ray?
Yes.
That's your district.
Well, Bill plays, but I'm sure I drive it every day.
Yeah.
So maybe, we'll have to revisit that, maybe, I think more with
I can certainly take it back to our public health education team and discuss it with them.
Can I just ask one question? I just want to make sure I got the right understanding of what the usage of the money is. So up there on Central Avenue, by Colony Shopping Center, where they put the divide in the middle of the street so that people trying to cross the street, they had a stopping place. Okay, the island. Now, is that part of this? Are these the type of things that we're talking about, or?
Doing education.
I am not, I don't have knowledge of that
Oh, okay.
particular thing, but I can check into that.
Okay. That's, I was just wondering. That's
Yeah.
okay.
It's mostly just awareness programs.
Yeah.
Yeah. And I need to
Sounds
check
right.
on that. It's possible that was a direct extension from this, but I just haven't been the boots on the ground for that particular, so I'll check on it.
Yeah, Albany will look at it.
Yeah,
That place is a
education,
nightmare.
that's all. Public awareness. Yeah.
Yeah,
That's all
it's
this is.
public health
Yeah, we
education.
talked about
So more
that.
questions for Commissioner Whalen on this? Motion to approve. By Shorty, second by Wine, all in favor?
Aye.
Any opposed? Unanimous.
We've been fighting this for years, but now it's worse.
Number 7, amending resolution number 39 for 2018 for the New York State Department of Health regarding the extension to the Healthy Neighborhoods Program.
So, we have been notified by the state of a one-year extension to our existing health insurance program. The contract had been set to expire on March 31st, but the state let us know that they were going to extend it. So we're just asking for that extension. The Healthy Neighborhoods Program, as I believe I've discussed with this group before, is a program that we work with Cornell Cooperative Extension to go out into high-risk neighborhoods and identify particular environmental risks and remediate those risks within the home, including things from diverse as lead paint to carbon monoxide. And we look for asthma in the home, and if we have a child that has asthma, we have a public health nurse that goes out and provides a home visit and assessment and liaises with the child's pediatrician to create an asthma action plan.
Wanda?
I noticed that 12204 is left off, and that's, I know that Manans and North Albany, they run in together. So I think that because of the fact that Manans is included, and North Albany is much smaller than Manans, okay, that it's being excluded from particular services. Hope 6, or the housing development that is there, for years they had a problem with the people in those homes having chronic lung conditions, okay, and dying, all right? But it's, and they said that they had tried to report it to, I don't know if you weren't around then, but I do know two people who died in that housing development there. So, and it says here that, you would have to, there's, what is this, home nursing practitioners, or what is that, HNP?
HNP just stands for Healthy Neighborhoods Program.
Okay, so, but these home visits, who's
Yep.
doing the home visits?
Certified asthma nurse. It's an employee of the health department.
Asthma nurse.
Oh, okay,
Yeah.
all right. And so,
Practical nurse.
which is to my point.
Yep.
Okay, and it had something to do with mold underneath those, the outside of the buildings, where they did wind up having to replace it. But my point is this though, because there wasn't a study or wasn't being followed because of the fact that 12204, those people wound up really sick, babies, and they just didn't receive the attention that they should have if they had been included in 2 and 6 and 10.
Well, these, as with some of our other grants, are limited to high-risk neighborhoods that have been data shows us where the highest risk is. Now, just because we have programs that are in these neighborhoods does not mean we don't have services in other neighborhoods that need it. For example, we work very closely with the city codes office on complaints related to mold. We send if anybody calls us and notifies of us of a complaint, we will send out somebody to do an
Talk to
inspection
firemen.
and to contact with codes and to do all that's needed to work towards remediation.
Okay, I'm gonna go back to my original point then, which is this. North Albany has the zip code 12204, which is the same as Manans.
Right.
Okay? And so, what it talks about here is the median income in these. And I don't think Manans is falling into, 29 and 26,000.
Right.
I might be wrong, but,
I think I neighbor Ms. Willingham, Allison McLean Line. I do represent Manans, and I do know what she's talking about because,
Right.
when they're just defined by zip, and her concerns are absolutely valid, is that right when you hit that line?
Yep.
Is where things change pretty dramatically, and it's I notice it, she notices it, Certainly, we have a lot more. What has happened is the older homes in the North Albany section have been divided up into apartments, and there are some pretty problematic, I would say, apartments there that I certainly hope are being inspected. And then when you get into, there's more home ownership when you cross the line into Manans, which is part of the town of Colony.
Yeah.
There's significant home ownership, and additionally, all of the apartment complexes, there's only a couple that are, that take Section 8. I believe it's Park Lane that
yeah,
does it.
right.
But the rest are predominantly newer, a little more expensive, et cetera. So I understand, and disproportionately in my district, I mean, I have one side of my district is a 33% poverty rate, and then the other side of my district,
Right.
it's,
Understood.
so I think that was,
Yes.
her concern. But I think also to be said, to your point, is you aren't specifically just targeting just a zip code. Those are neighborhoods within those zip codes, would that be correct? Or you are targeting those zip codes?
Well, it's both.
Yes.
you
Yeah,
know.
yeah.
It
I
is.
mean, if we
It's
have
targeted.
outreach within those zip codes, we can go, and we are doing door-to-door.
Okay.
In some of the particularly high-risk neighborhoods, staff goes door-to-door.
Okay.
Now, just to be clear, they don't inspect a home and they don't have any oversight.
Yeah.
What they do is kind of examine the home and determine if there are any concerns that they might have, like for providing linens for mattress protectors and pillow protectors and cleaning supplies, so that, if there's a child who's asthmatic, they're not inhaling a ton of dust.
Yeah, yeah,
And
or-
they work with people, and they provide a lot of supplies.
infestation
Yeah,
stuff, yeah.
exactly. So they work with other agencies on that. But certainly, if they went into a home where they felt that there was an unsafe circumstance, they'd let us know, and then we'd take it from there.
And I also think that certainly, at least I know from the rental properties that my parents own, that every 2 years there is an inspection by the fire department in Albany. And I'd love to know how those two, and maybe that's something,
3 years now.
how those two.
It's 3 years now. They don't do it.
Yeah, how they, if they notice
Used to
problem in
be
the
too.
homes, and then they
Not
ultimately
anymore, that's
report
right.
that on, but that's something I'll discuss with Wanda and see.
Okay,
Thank you so much.
thank you.
Thank you.
Thank you.
Any other questions? Any motion to approve? By Wanda, second by Shirley, all in favor? Number 8,
So this is directly related again to the Healthy Neighborhoods Program. So it's just a request to amend the current contract with Cornell Cooperative Extension to implement services under the Healthy Neighborhoods Program grant. So we're looking for a no-cost extension with the updated contract, and this is tied to the extension of the contract.
Great, let me get that. Wait, Patty.
any questions? Any motion to approve?
Motion.
By Wanda, second by Ally, all in favor?
Aye.
Number 9, authorizing an agreement with Health Research Incorporated regarding the expanded partner services program.
This is another fairly long-standing program. which provides HIV prevention and care services within Albany County. The county finds people that have HIV and have not been engaged in medical care and re-engages them with medical care to make sure that they're on appropriate medications. They test partners and notify them and refer all HIV positive and high-risk negative patients they encounter to appropriate prevention care and support services.
Adding to that.
Any questions?
Yeah.
Can I get a motion to approve? By Ally, second by Gary, all in favor?
Aye.
Opposed? Unanimous. Next one, number 10, authorizing agreement with the New York State Department of Environmental Conservation regarding the water quality management program.
Okay, this again is long-standing. I'm looking for a 5-year grant period from 2019 to 2024. We get $10,000 annually to review and approve of all new sewer district extensions associated with new subdivisions and multifamily developments, investigation of sewage spills and issues associated, investigation of sewage that may impact waterways of Albany County and sewage-related concerns made by county residents. And we have a couple of engineers that this gives a tiny portion of their salary for this work.
Can I ask a question when you get a chance? So, the PF, what is it, PFOA? Okay, so, now this is about water quality, is that right? Yeah. So, how would this keep us from being impacted the way the people in Hoosick Falls were, that went on as long as it did, and either nobody knew anything about it, or they did know and they didn't, it wasn't followed the way that it should be. So what does this do?
Okay, so in particular with PFOA, before what occurred in Rensselaer County with PFOA, this would have done absolutely nothing to help anybody because PFOA was not monitored for. It was not a chemical that was monitored for in waterways. And I think that's what happened in Hoosick has changed that.
Yeah.
So now that is monitored. So we do become aware of any concerns related to chemicals that are currently being monitored in water systems. And in those situations, we would work with the state and work with the municipalities' water boards to remediate in any way that we would need to. So that would include something like PFOAs, and it would include other compounds that are monitored.
So who does the testing?
So
The state?
the state does the testing.
And then you get the information?
Yeah, we get the information.
There's no Republicans here tonight.
Every municipality.
We
gets
do
tested.
some,
Yeah.
and the municipality does the testing for the waters, the water boards of the different municipalities. There are rare circumstances that we assist in testing when we're looking at properties that have wells. And then if we get any concerns, we follow up with those. So the state would notify us of particular concerns, and the water boards would notify us as well. We're in good contact with them.
Any other questions for Commissioner O'Malley? I'm sorry. Go ahead, showing up.
Well, I was just, I believe this contract relates to sewer extensions.
Yeah, so
with
this
all-
contract is.
They review the site plans and make sure that
They look at site
the flows are
plans.
correct
Yep,
and not.
so it's really kind of trying to determine whether building a new structure will overwhelm the current
Yep.
infrastructure. And that's kind of their job, to
Never
look at
looked
these
at anything in Albany,
plans
do
that are
they?
provided to the builders and sign off on them.
And they have to provide for offsets if they're gonna contribute.
Medication
They
fees
they
and
have
things
to,
like
if they're
that.
gonna contribute to additional sanitary flow or storm flow, then they have to offset it by, the developer has to offset it by 4 times the amount somewhere else in the system.
So this is all done before the planning board just votes on it, right?
No, not really. It's part of the site plan process. Not so much before they we vote on it, but before they build it, obviously.
Yeah, because they have to be reviewing plans that are already established.
Correct.
Oh, did you have a question?
Yeah. You indicated that you're looking at site plan, so if there was a apartment complex that was being built to replace an office building, then that's something you would look at as far as the sewage flow out of that apartment complex?
It depends on what structural changes were being made to the apartment complex.
Well, it's being torn down, the building's being torn down, apartments being built there.
Yeah, usually if there's a significant architectural change and they would need to submit plans, you'd have to sign off on it.
They're adding over 2,500 gallons a day, I believe. It has to go through this program.
So
Thank you.
then, I'm just thinking like right where we are right now, down there on Broadway, there's like all these, a lot of those new buildings that they're right across the street from one another. Those apartment complexes that they're building down there, right? I mean, that should come to quite a, what, you said 2,500?
2,500.
It's going to be a problem, because Albany's got over 1,000 units being on the books with developments, with apartments.
But the develop, they have.
So I don't know how this is going to affect the sewer system in the
Well,
city.
the developers
But
have
I'm
to
sure that's what
provide
this is
the-
all, these people will deal with, but
They have to do an
there's
investigation.
like 5 major,
And they pay
even the one
mitigation
Paul's
fees.
talking about, that went from, what was that, Paul, 500 down, what are they down to now, 200?
Yeah, something like that.
Something like that. I mean, so, and then you got another 150 on Ontario, and they want to put another 200 up on Washington, 250. So it's got to give somewhere. It's an old system.
It is an old system.
So specific to number 10, can I get a motion? Dawn, second by Ally, all in favor?
Aye.
Unanimous.
I think we just need to be a little bit more aware of what we're voting on.
Motion.
and
Well,
what
no,
we're